Some honorable mentions. Keshav, actually, yes, there is this really Keshav deserves a some appreciation. Actually, everyone clap for Keshav. Actually, yes, whenever I need some person, okay, in person, I need any help, I can confidently say that it is Keshav who will come near me. Actually, yes, really, Keshav is very good at it. I saw many times. Yeah, I said literally you need, I said you need to carry some weight, and he is ready actually. Okay, for camps, I said him to come to lab on holiday. He came, and even Abhiram also actually, yes. So they came and they helped me, and that is not a fancy work actually, packing everything, dusting, but they did it, and yeah, that is real. That is what the most important criteria. I want to tell one more interesting thing or important attribute. See, conducting a camp or an event is simple thing. The good persons are the one who is there at the end of the event, who will secure back the event back to the department. That is very important, right? And almost none of the smart, so-called smart people won't be there at the end of the, peak moments actually. They will run away. They will come, they will do, and they will run away. And they are not there for that last minute, tapping in the back to support, I mean. Yeah, they too deserve it, and this time there will be a rigorous involvements in the medical camps, and everyone must be there with me or in the medical camps, okay? Up to the last minute. I won't give hard works to girls or boys. There will be fair allocation. Don't worry. Okay, but you must be there. Yeah. Coming back to the academics, the subject is basic hematological diseases. Keshav chocolate. I forgot. I will give tomorrow. Okay. Later. Yeah. But he deserves. Well done, Keshav. I appreciate you. Okay. Enough. Back to classroom, okay? Back to academics. So, yeah. I don't know from where I need to start this one. If you see the syllabus, I will give a quick syllabus overview. So, there are 3 units, right? Unit 1, 2 and 3. Unit 1 has 3 important topics. One is absolute values, hematological values, anemias, and third one is leukemias, and another topic will be WBC abnormalities in the WBC. These are the major topics in Unit 1. Then major topics in Unit 2 are bleeding disorders, then fibrinolysis. Yes, I know what you are thinking. I will give justification, don't worry. And yeah, bleeding disorder tests. In this semester, we will focus more on lab tests of bleeding disorders. Last time we studied about fibrinolytic mechanism. You already know the theoretical aspects of them. But do you know how to calculate PT, CT, APTT, TT, TGT? We didn't study them, right? So we will focus on how to diagnose the bleeding disorders, how to rule out it is a hemophilia, how to rule out this is a hemophilia A or B, how to rule out whether it is a vascular defect, how to rule out whether is there any other thrombocytic purpura. All these are bleeding disorders. We didn't discuss them. Just you know the surface terms. Can anyone say what is purpura? See? Yeah, what is purpura?
Internal bleeding.
Internal bleeding. Then? Yes, there will be a rashes, spots, okay, red spots on the skin because of internal hemolysis, bleeding and hemolysis, right? It's both a combination of bleeding and hemolysis results in rashes formation on the skin. That is called purpura, and that is a very deadliest condition. If we are not treating purpura can lead to what? DI. See, what is full form of DIC? Disseminated intravascular coagulation. What is the consequence of DIC? There will be blockage of blood vessels. If blood vessels block, what happens? Dead, right? So yeah, all these things, the lab, the investigation things will be assessed in the unit 2 of bleeding disorders. Okay, that will be main focus in this semester. Then third unit will be quality assurance. I know again, and quality assurance and early cell phenomenon. Some advanced hematological conditions we will discuss. Okay, I have changed the syllabus as I stated, but I limited syllabus. I aligned the syllabus with MOHW actually. So MOHW given some syllabus. I have seen the basic hematology syllabus there, and I kept same topics in this syllabus. Okay, excluding third semester content. Okay, I removed most of the third semester content. Okay, so this will be fresh and we will try to study in a new way. Okay, we will try our level best. In the quality assurance also we will discuss about calculations. Moreover, mean, median, mode, standard deviation, correlation, and regression studies. That we will see. How to calculate mean, how to calculate median, mode, all these things we will see. And there will be some calculations you need to do, okay? So get ready for that aspects. That will be really interesting actually. This is the syllabus overview. Yes, Geeta. Yes. Okay. So this is all about the syllabus overview. Then the first topic will be absolute values. So before even discussing about absolute values, let us re-emphasize on what is hematology. So what we are doing with hematology, students? What are the real world implications of hematology? Why Niketan smiling there? By the way, very interesting thing. Yes. Yes, what is hematology? Tell me, students. Why it is important? Why we need to study it? Why we need to study? To diagnose blood disorders like blood cancer. Any more? HIV. Who said HIV now? I think now the position has been taken here. No, not HIV. Malaria.
No, sir.
Anemia. Okay, she is saying anemia. Okay, you give me a patient example, students. At what condition you will start doing the hematological investigations in the patient? At what instance? You got a patient to the lab. Why you obtain a hematology test to the patient? Why you choose a hematology test? You got my question? We got a patient. Rather than going with some microbiology test or biochemistry test, why you opted hematology investigation? Why? Okay, see. Now Navjot saying that since we are taking blood, it is hematology. So you are not collecting blood in biochemistry then. Are you collecting blood sample in biochemistry?
Yes, sir.
Right? So is biochemistry hematology then? Is it a sub-branch of hematology? No. See, there are these confusions. Just there is an involvement of blood doesn't mean it is hematology always. Right? What parameters you are checking in that sample? If you are only focusing on a blood related investigation, then it might be a hematology. Right?
It also includes fluids.
Okay, it also includes, hematology includes fluids. Yeah, these are the confusions. Listen, in hematology we are only focusing on RBC, WBC, platelets and their disorders, bus, and also hemoglobin. That's it. Okay. Other than this, we won't focus on any other things in hematology actually. Fluids will be studied in clinical pathology. In clinical pathology, we will focus on all body fluids. Okay, here we might choose the plasma studies. Okay, very less significance. Okay, we might go for plasma protein analysis. Again, plasma proteins is a biochemistry actually. Got it? It's proteins. So yeah, we are restricted to this and blood cancers. Blood cancers will be studied in hematology. That's it. If this is as simple as this, then is it a simple subject? You need to see hematology MD textbook. The textbook is this much long. Okay, MD in hematology is a very big subject. Why this is hard to study? Why studying RBC, WBC is very tough? Any guesses? Why studying blood is tough?
Because the blood is flowing all over the body.
Very good. Everyone clap for Miss Muskan. The first appreciation. Very good. See, blood is flowing all over the body. Okay, blood is also called as fluid of body, fluid of life, right? Listen, I want to tell again, there is a readjustment of this definition. Blood is fluid of life as long as it is in the flow. As long as blood is in the flow, you are alive. If your blood stops, you are dead. Now you understood the significance, right? So just movement of blood is sufficient then. So we got a patient, dead patient. So what we did, we started circulating blood manually with a machine. Will he be alive? Then what is the link between blood and life? It's interesting questions. Yes. Listen now. When I say life, I was meant to say either psychological or biological. There is a difference between psychological life and biological life. Okay. Listen. Biological life will be sustained by the blood. What is psychological life means? Brain death. Your all organs are functioning, but when your brain is not there, then we will classify them as a legal dead patient. Okay, so keep our little brain aside. Let us focus on blood. Okay, so yeah, the brain. I don't know why I came brain. I will tell one more interesting thing. When you fall in love, you will say no, your heartbeat will increase. Actually, the love sensation is given by the brain. It's a psychological, but you are giving credits to the heart, right? So heart getting all the credits of love, right? By the way, so that means there is something interesting thing about heart. You know what is the primary function of heart? Again, to keep the blood in flow. So again, you know, it's a connection, it's a cycle of life. So you need heart to be, you know, biologically alive. Then only you will be psychologically alive. So there is a balance between, you know, the cycle of life with heart, blood and brain. See, BBB, right? Very good. Okay, heart, blood and okay. Anyway, yeah, fine. So why blood is important again? Then why blood in movement is important to maintain a biological life? Yes.
Oxygen supply.
Very good. Everyone clap for Shubhi now. Very good. To carry oxygen. Without oxygen, we cannot stay alive. We are eukaryotes and we are, you know, aerobics, right? Not anaerobics. So we need oxygen for our survival, right? We need oxygen for our survival. Now, what are the types of tissues we have in the body? We have all types of tissues, right? Skeletal tissue, muscular tissue, muscular skeletal, say, then, okay. Cardio tissue, then connective tissues. So, entire body tissues require oxygen for their survival. Am I correct? Every tissue need oxygen for its survival. And who will provide oxygen to the tissues? Again, it is blood. It is RBC to be precise. RBC carrying a protein called hemoglobin, and hemoglobin carrying oxygen, and oxygen keeping the tissues alive. Overall you will be alive. So there is a very close link between oxygen, blood and tissues. Now we are seeing at a level of oxygen level, right? So very interesting thing. 30 seconds, 30 to 40 seconds, if your brain tissue not getting oxygen, you will be in coma. If you don't get the oxygen for 3 minutes to the brain tissue, you will be a legal brain dead patient. 3 minutes, no oxygen to the brain is enough. Then you might ask me a question. Sir, we can survive by closing our nose, right? How we are surviving? There is still oxygen in the blood actually. Okay, so that will be utilized. Okay, at one point that will be gone and you will die. Maybe to an extent up to 8 minutes you can survive. After 8 minutes, the 2 minutes is a buffer period. Then game over. Okay, yes. Unless you have a very large chest to keep more time. Okay, oxygen. Yeah. That's what the Olympic athletics they can do. Deep dives because they're trying to have a large cavity. They have these aerobic exercises. Yeah. So I connected blood with oxygen. So oxygen is very important. Then, by this you understood that hematology is about study of these cells. Out of these cells, what is the primary cell can be categorized as anemia. Okay, what condition is attributed as anemia? That is RBC. Okay, RBC has the celebrity status among other cells because it is RBC who is providing oxygen, keeping us alive, right? So any abnormalities in RBC results in anemia. So if I say define anemia, what you can say? Anemia is a condition where the RBCs might get affected. Okay, resulting in decreased oxygen carrying capacity by RBCs. Anemia is a condition where there will be an impairment of oxygen carrying to the tissues because of some problems with RBC. Results in anemia. Okay. So anemia is directly linked with oxygen and RBC. Now, what things will damage the RBC resulting in anemia? What things? Yes, one is hemoglobin level. Then, so when there is less hemoglobin, less oxygen carrying, obviously you will be affected by anemia. Then, surface area, very good. So surface area, a fancy word, nice. So what do you mean by surface area of RBC? Size of the RBC rather than shape. Okay, we will see that. Size of the RBC, let us keep simple. So enlarged RBC is called as yes. Enlarged RBC is called as, that condition is called as macrocytic anemia. Okay, macrocytic anemia. Then decreased RBC size is called as microcytic anemia. By the way, listen, in macrocyte, when the RBC enlarged, there should be more hemoglobin. There should be more oxygen carrying capacity. So you should be more healthy, right? You got my point? Macrocytic anemia. Why macrocytic? We are saying anemia. It should be a macrocytism. That we will be more stronger, right? But why it is anemia? Any guesses? Oh, very good. Yes. To that big size, but the HB is same. So adequate amount of HB is not distributed to the larger cell. That results in this condition. Very good. What if there is? Okay, that's it. That is my answer. Is there any chance that there is a equal HB content along with a larger cell? Larger cell, I mean normal cell is 7.5, but here it is 15 micrometers. and it has sufficient HB also, maybe some 20 grams per deciliter. Is it possible to have such anemias? Even I don't know actually. But I think there will be a biological limitation. I guess even if it is a large appropriate HB content cell, the limitation might be our blood vessels, capillaries are made for 7.5 diameter cells. They are not made for 15 diameter cells. So there will be some obstructions. So it will again trigger anemia. Okay. So we are forgetting the other system, other things involved in this system. Yeah. Fine. So that is one condition to get anemia. Any other conditions to trigger anemia? So far you said less HB, then you said RBC size abnormalities. Any other conditions triggering anemia? RBC count. Okay, overall count of the RBC. Very good. When there is a less count, less carrying capacity, overall collapse. Right? So RBC count, decreased RBC count result in anemia. Any more? Very good. Bleeding. Bleeding can lead to anemia. Yes. Pregnancy also I will take. So excessive bleeding. Okay. There is another word for bleeding in hematology. What is other name, medical term for bleeding? Hemorrhage. Very good. Everyone clap for Shubham. Hemorrhage. Are clap? Oh, there is so many things. Hemorrhage. Enemies. Okay. Hemorrhage. Very good. Bleeding can lead to anemia. Any more? Pregnancies. Okay. Pregnancies, during delivery there will be an anemia. During carrying time, okay, during gestational period there will be anemia. Why there is anemia during gestational period? When the mother carrying the baby. Fetus has a small, it's a small life, small surface area of the fetus. Don't expect that fetus will have a sufficient blood production. So it is obviously the mother who is pumping oxygen, indirectly through placenta. So obviously pregnancy will trigger anemia. Any more? Malaria. Yes, we can say malaria as a hemolytic anemia. Hemolysis occurred because of some infections. Parasite destroyed the RBC, resulting in anemia. Any more condition? Chronic kidney disease. Alright, this is from Karamveer. Everyone clap for Karamveer actually. Very good, Karamveer. Chronic. Now, Karamveer, can you justify your statement? Is it possible? How chronic kidney disease results in anemia? I still appreciate his confidence. Any others? Why chronic kidney disease results in anemia? What? Okay, I will take that as one point. She is saying that there is a damage to the nephron, so the RBC is escaping from nephron, and rather than your urine is in yellow, now you are getting vampire urine. Okay, reddish urine and you die because anemia happening. Okay, that might be one condition, nephrotic anemia. Okay, any more? You need to justify it, Mr. Archie. Dialysis anemia. Justify it. He came close, but I need justification. I think Diksha can say, or should we can say this answer, right? Or Shubham? Yes. How kidney disease results in anemia?
I said erythropoietin.
Very good. Erythropoietin. Everyone clap for Diksha now. Are should be what happened to you? Very good. Erythropoietin. Yes. Erythropoietin is secreted by kidney. Suprarenal gland, okay. Suprarenal gland, a part of kidney, right? So be specific. Very good. So yeah, that can lead to an anemia. Very good. Any more?
Iron deficiency.
Very good. Diet mediated deficiency results in anemia. Very good, Shukri. Clap, clap. Very good. So iron deficiency. Any more in nutrient based anemias? Apart from iron, any others lead to anemia? Vitamin B12, very good, Lakshya. Whether vitamin B12 deficiency lead to anemia anymore? Bone marrow disorders. That is a separate criteria. Very good. Okay. Now listen. I want to tell. Sorry from my end. I forgot to tell that bone marrow failure. Bone marrow failure or bone marrow not producing sufficient amount of RBC. Okay. That lead to an anemia. That anemia is called as bone marrow depletion or bone marrow deficiency anemia is called as what?
Aplastic anemia.
Yes, actually I forgot to tell you and the external asked that question and I felt sorry, no? I felt sorry on myself because I didn't teach you. Yeah. Aplastic anemia means bone marrow failure. Bone marrow failure is called, very good. Bone marrow failure is called as aplastic anemia. Is there any other wild conditions resulting in anemia? By the way, wild conditions resulting in anemia. Yeah. Apart from these, any new things? So I muttered someone, so not such wild. Yeah. Huh? Injuries, hemorrhage. Okay. During surgeries and injuries, there will be an anemia. That means, listen, can you tell me the name of such anemia? There is a huge blood loss. Huge blood loss will cause an anemia. What type of anemia is called as that anemia? Huge blood loss. What anemia is attributed as huge blood loss mediated anemia? Any idea? Okay, what is the normal volume of blood? 5 to 6.57 liters, right? So when the volume of blood is reduced, such a condition is called as not micro. Micro is at cellular level. Now I am telling volume of entire blood. Mega, liters, 5 liters. Now tell me, decrease some 3 liters of blood is there. That anemia is called as. Can I say? Hypovolemic anemia. Okay, hypovolemic volume. Okay, if it is less than 5 liters, that is called as hypovolemic anemia. Hypovolemic anemia. Okay, please keep in mind. Reduced blood volume results in a triggers an anemia called hypovolemic anemia. Okay. Since this is first class, I am not taking board notes point of view, but just listen basics. Okay. Then any other conditions to get anemia? So far you did well. Hemolysis we discussed, infections we discussed. Yes, Shubham. Folate deficiency. We already discussed with iron deficiency and vitamin B12 and folate also a nutritional based anemia. So correct, yes. Folate deficiency anemia I will take you. Yeah, folic acid deficiency anemia. Very good. Anyone? Triggers of anemias. Any other triggers to anemias? Abnormal menorrhea. You know what is menorrhea means? Excessive bleeding, menstrual bleeding. Excessive menstrual bleeding can lead to an anemia. Okay? Excessive menstrual bleeding can lead to an anemia. Anyone? Have you heard about autoimmune hemolytic disorders? What is this autoimmune hemolytic disorders? Autoimmune hemolytic disorders. What is the time exactly? Tell me in number. 11:45. This class still 10 minutes left. Okay. Yes. Autoimmune hemolytic anemia. Okay. So there will be some abnormal antibodies. These antibodies will attack our own cells and they will lead to hemolysis. Any example of hemolytic immune mediated hemolytic anemia? Any one example? We all know that example. Antigen antibody, he came close. Any more? AIDS. Yes. One example of antibody mediated RBC destruction. Arey yaar, ye sentence they are not living this. Antibody mediated RBC destruction anemia. Example. Six. Who is that? Arjun, it is you who is giving misguidance to current disease. Sickle, what in the world antibodies mediated in sickle cell anemia? Tell me. Yes. Antibody. Shall I tell the answer? You want any clue?
Yes, sir.
Blood banking. Now tell me. Mismatched blood grouping. Right? I am A group and should be this B group. I have B antibodies. When I given my blood to him, game over. Right? My antibodies attached. So yeah. So that's it. Opposite antibodies attacking vessels. Mismatched blood transfusion is one example of antibody-mediated hemolytic anemia. Very good. Any last and final? Few drugs, okay, few tablets will interfere with RBC production and they will trigger some anemias. Okay, that can be a cause of getting anemias. Very good. Yes. This is all about the anemia. Okay. Now, what will be some symptoms in the patients when there is an anemia? How you will you will identify that actually you might have an anemia. Fatigue. Why fatigue will be there in the anemia? What is fatigue means? Lethargy. Okay. Yes. Why laziness is associated with anemia? Because all tissues are lethargic now. They have less oxygen, they are not active. So overall you will feel lethargic. That is one symptom. Any other symptoms of anemia? Red eyes. Red eyes or pale eyes? Pale eyes. Pale skin. Then any more symptoms of anemia? Jaundice. Any more symptoms of anemia? Listen, I will tell one deadliest sign of anemia. Very, very deadliest. It's a sign of DIC. You give a blood transfusion and suddenly patient having syncopes. Syncopes means he's unable to breathe. Okay? You just imagine blood started, clotting in the lungs. So patient will start hyperventilation. That is called as hypoxia. Anaphylaxis. Yeah. Anaphylaxis. Anaphylaxis. Okay. So excessive breathing issues because of clotting of blood in the lungs. That is anaphylaxis shock. There is an anaphylaxis shock. So that is one of the diverse symptoms stating there is an ongoing destruction. Okay. Blood in the excessive hyperventilation because of bleeding in the lungs. Okay, that is called anaphylaxis. Many things are there actually to discuss. So this is all about a few things about anemia, and tomorrow onwards we will have proper classes. First and foremost, you need to know the all normal values of all blood values, right? So what is the normal percentage of eosinophils? 1 to 2%. Very good. That is eosinophils. Then monocytes? 8 to 12. 8 to 12. Okay. Similar range. What is the normal value of platelets? 4,000 to? Yes, 11,000. Platelets. Normal value of platelets. 1.5 to 4 lakhs. See, everyone's thinking with others, they're escaping. Like they know the normal value. Okay, tomorrow onwards we'll see. Okay, thank you very much. Let me take the attendance now. Yeah.